Mental health has been a big topic during COVID-19. How to cope and adapt to the change that everyone has experienced. Well, now psychologists are looking at a new set of mental health challenges that people may experience post-pandemic. News 5's ERIN CHAPMAN is live with us tonight to share what those might be. ERIN?
Good evening, Andy. Yes, this year everyone has had to make some sort of adjustments one way or in another. And now, with the vaccine officially out, we begin to see that little light at the end of the tunnel. However, I spoke with some psychologists today, and they tell me it could come with some challenges. In the early stages of the coronavirus, many struggled with the uncertainty of not knowing what was going to happen. And that unpredictability forced us to change a lot in our everyday routine.
Everybody was scrambling to figure out what to do.
Whether it's working from home.
Right now, I'm trying to work and my kid's in the background.
Or teaching your third grader long division at the kitchen table. We adapted.
There's so many different factors that we've had to get used to.
Fast forward 8 months and we're here in December with a vaccine. So does that mean once everyone receives it, life can go back to normal? Well, according to Dr. COYLE, not so much.
I think it's going to look different. I think that people are going to have different problems than maybe they did before.
Dr. COYLE says a new set of mental health challenges can present themselves.
People might reach out for different reasons now than prior.
When life slowly returns to how it was pre-pandemic.
Now they have to figure out, like, how do I go back to work? Or what is my life going to look like if I don't, recover or improve?
And we might ask ourselves,
how do we reconnect and how do we really, come full circle?
And COYLE says, although there is a vaccine, many might just have the element of fear to go back out.
I know that anxiety is definitely going to be there.
So what can we do to be proactive? COYLE suggests we break it down into smaller pieces. And in doing so, COYLE uses the work setting as an example.
Everybody has their different level of comfort with COVID. And I think that assessing your situation and definitely trying to work with your coworkers, your boss.
Meaning if you really aren't comfortable going back into work quite yet, Dr. COYLE suggests to communicate your concerns early on. And most importantly, if you recognize yourself feeling a bit anxious,
it's okay to reach out. It's good to get that help.
Now, if you or somebody that you know is facing any of this anxiousness, Dr. COYLE suggests that you go to ThriveWorks website where you can find more resources. Always watching out for you, Southern Colorado. ERIN CHAPMAN, News 5.